How you doing today? I'm speaking to Sacral. What's your name?
Marcel.
Okay, nice to meet you. So today I'll be doing some lumbar spine and lower extremity testing today.
Okay.
If anything hurts, please let me know. If you have any questions, please let me know as well.
Okay.
May I begin?
Yes, you may.
Okay. So first we're going to start off with minor sign test. So I have the patient in the seat position and I have him just stand up for me. Straight up. Okay, good. Okay, you can relax. So positive is the inability of the patient to sit up from a seated position or may need assistance standing up. Which may indicate sciatica, lumbosacral, or sacroiliac joint lesions. All right, now we're going to move on to the belt test. So I have the patient standing facing this way. May I contact your PSI?
Yes, you may.
All right. Okay, so I'm going to have the patient bend down, touching their toes for me. Okay, you can relax. Okay, now I'm going to place my hip on his tailbone. And I'm going to have him bend down one more time for me, as far as you can. Okay, you can relax. All right, so positive is low back pain. So indications are if he has pain with both movements, then it will be a lumbar spine problem. Or if he has pain with the first movement, then it will be a sacroiliac joint problem. All right, now we're going to move on to the Valsalva maneuver. All right, so I'm going to have you clench your fists together. And I'm going to have you take a deep breath in. I'm going to have you squeeze down and like you're taking a bowel movement. Okay, you can relax. Okay, a positive is radiating pain from the site of lesion, and which may indicate nerve root entrapment by this lesion. All right, now I'm gonna have my patient perform the heel walk test. All right, so I'll have you stand over here for me. Okay, and in a second, I'm gonna have you stand up on your heels. I'm gonna have you take a few steps forward. All right.
Okay.
Okay, so whenever you're ready. Okay, you can relax. Okay, a positive is inability to perform the test. Which may indicate L4 disc lesion when applying pressure on the L5 nerve root. All right, now I'm gonna have my patient perform the toe walk test. All right, so I'm gonna have you stand up here for me. And in a second, I'm gonna have you stand up on your tippy toes, and I'm gonna have you take a few steps forward, all right?
Okay.
All right, whenever you're ready. Okay, you can relax. Okay, so a positive would be inability to perform the test, which may indicate a L5 disc lesion when pressure is applied on the S1 nerve root. All right, now I have my patient perform the KIP test. So I have the patient in the seated position like he is now. Now I have him cross his arms for me. All right, now I have you lateral flex to the left side. And I'll stabilize his right PSIS. And I will reach around him. And I will turn him towards me. All right. And I'll go over to the other side, which I'm stabilizing the opposite PSIS. All right. I'll reach around you. And I'll rotate you towards me. You can relax. Okay, so the positives would be radicular pain or local pain. If he has radicular pain, I'm turning him away from the lesion, then it will be a medial disc protrusion. If I bring my patient toward the disc lesion, then it will be a lateral disc protrusion. The last indication for the local pain would be lumbar spasms or facet capsulitis. I'm performing tests for sciatic nerve. The first test we'll start off with is a straight leg raise test. So I have my patient lay down, and I will be bending your leg up to 90 degrees, all right?
Okay.
Thank you. Okay, a positive is radiating pain and or dull pain in the posterior thigh. This will indicate sciatic radiculopathy and or tight hamstrings. When bending the leg between 35 to 70 degrees, this will equal possible discogenic sciatic radiculopathy. If it's greater than 70 degrees, then it'll indicate tight hamstrings. All right, now we're gonna move on to the Burghardt test. So this would be a test if the straight leg raise is not positive, if there's no positives. So I'll raise the leg up again, 90 degrees. All right, then I'm gonna lower it down 15 degrees. And I'm going to dorsiflex your foot, okay? Okay, a positive would be radiating pain and or dull pain in the posterior thigh. This will indicate sciatic radiculopathy. All right, now we're going to move on to the Sacral test. So I'm going to flex your leg at 90 degrees. All right. And I'm going to bring it down 15 degrees. And I'm going to dorsiflex your big toe this time. positives are radiating pain and or dull pain in the posterior thigh, which will indicate sciatic radiculopathy. Okay, now we're going to move on to Lumbar's test. So this test will be done if the patient cannot perform a straight leg raise or in extreme cases of sciatic radiculopathy. So I'm going to flex your head. You keep your hands like that on the door. Okay, positives are radiating pain down the posterior thigh, which will indicate sciatic radiculopathy. All right, now we're going to move on to the Turin sign. So this test will be done in extreme cases of sciatic radiculopathy as well. All right, so I'm going to dorsiflex your big toe.
Okay.
All right. The positive for this test will be pain in the posterior thigh, which will indicate sciatic radiculopathy. Okay, now we'll move on to the bonnet sign test. All right, so I'm going to raise this leg up slightly. Then I'm going to internally rotate it. And I'm going to bring it towards me. All right, and from here I'm going to raise it up to your opposite shoulder. Okay, you can relax. Okay, positive is radiating pain or dull pain in the posterior thigh, which will indicate immediate pain of sciatic neuropathy from piriformis syndrome. All right, now we're going to move on to the well leg raise test. All right, so my patient has pain or sciatic radiculopathy in the left leg, so I will be raising up your right leg, all right, to 90 degrees. All right. So positive would be increased pain in the affected leg. Another positive would be decreased pain in the affected leg. So if there is increased pain in the affected leg, then there will be a medial disc bulge. If there is decreased pain in the affected leg, then there will be a lateral disc bulge. Okay, now we're going to move on to the femoral nerve traction test. Okay, so I'm going to have my patient tuck in his chin for me. All right, I'm going to grab the top leg, and I'm going to flex it back here while I stabilize at the hip. And I'm going to bring it back even further. Okay, so positive would be pain in the anterior portion of the thigh. Indications are traction of the femoral nerve, which is involving L2, L3, and L4 nerve roots. All right, now we're going to move on to the Tenel foot sign. All right, so this is a reflex hammer. That's what it feels like, is that fine?
Yes.
All right, so I'm going to be tapping at the medial plantar nerve. Okay. All right, so positive is paresthesia at the bottom of the foot, which will indicate tarsal tunnel syndrome. Now we're going to move on to Morton's test. All right, so I will be squeezing your foot below the toes. Okay. Positive is sharp pain at the forefoot, which will indicate metatarsalgia or neuroma.